In today's video, I'm gonna demonstrate nasogastric tubing. So let us know first what is a NGT for short. So a nasogastric tube or NG tube is a special tube that carries food and medicine to the stomach through the nose. It can be used for all feedings or for giving a person extra calories. So, good day ma'am. I'm Valerie Anem Cortez and I'm your caregiver for today. So, ma'am, may I know what is your name?
My name is Evelyn Villares.
How about your age, ma'am?
I'm 57.
So, ma'am, can I check your wristband? So, thank you, ma'am. So, today, ma'am, we are going to do nasogastric tube insertion in order for you to promote adequate nutrition. So, ma'am, please allow me to close your curtain for your privacy. So, these are the equipments that I will going to use. The stethoscope and the pen light. Tape, cup of water with straw, the improvised pH strips, the improvised water-soluble lubricant, specimen cup, pad or towel, a nasogastric tube which is inside this envelope, and the syringe. So the syringe should be a 20cc syringe, but for now we're gonna use this for our return demonstration video. Before applying the procedure, make sure that you wear your clean gloves. And then place your patient in a high Fowler's position or semi-Fowler position. And then cover patient's chest with towel or pad. And then explain the procedure and make sure to develop any appropriate hand signals or gestures. Assess your patient for any facial or nasal passage issues using a pen light. And then get the nasogastric tube. And then measure from the tip of the nair to earlobe to the xiphoid process using nasogastric tube. And then mark the distance on the tube with a piece of tape. After marking the tube, lubricate 4 inches of the tube with water-soluble lubricant. And then ask your patient to slightly flex neck backwards. And then insert the tube to the patient gently. And then give water with straw if applicable, or give patient dry swallow if necessary. And I forgot to put in the clip, but ask your patient to tip forehead forward. Advance the tube until the tape or mark point reaches the nair. And then secure the nasogastric tube in place. Do not let go the tube until not secured. Secure the tube in the nair. And then verify placement of tube. And then auscultate your patient's stomach to assure that the tube is already on the stomach. And then get the syringe. So in reality, the syringe should be 20 cc. And then aspirate stomach content to collect gastric content. And then put gastrate content on a specimen cup. After that, get the pH strip and then test the pH level of your client. First, stop the patient feeding machine for an hour or more before removing the nasogastric tube if necessary. And then don't forget to hand wash or do the hand hygiene. And then clean your surface or your working area with disinfecting wipes and then discard the wipes that we have used. And then cover your workplace with towel. So these are the equipment that I will going to use. Gloves, syringe, improvised pH strips, and then cup of water. Do the hand hygiene again and then put your gloves. After that, check the placement of the nasogastric tube by testing pH level. Get the syringe and then remove the stopper. And then aspirate for any stomach content to test the pH level of your client. And then remove. And then close again using the stopper. And then put gastric content on the strip. And then you can now check the pH level of your client. After you confirm that the tube is in the stomach, get some prescribed water using the syringe. And then open again the stopper on the tube. Then flush the nasogastric tube with correct amount of prescribed water. Flushing helps prevent stomach content from entering in the throat and lungs when you pull the tube. Then close first the tube with the stopper. And then remove the tape gently. Pull the tape gently or slightly. And then pinch the nasogastric tube and slowly pull the tube. Okay, slowly pull the tube. After pulling the tube, put the nasogastric tube on prescribed trash can. And then remove your gloves and then discard it. And then do the hand hygiene. And then get some towel and put on water. And then wash your patient's face or around the nose. And then get another towel to pat dry the patient's face. Then discard it. And lastly, check for skin irritation or damage from the tube or from the tape. Then do the hand hygiene again. Then gather all the equipment that you have used. And lastly, clean your workplace area. And don't forget to record all the findings or all the procedures that you have done. So that is for today's video, which is about NGT or nasogastric tubing. So in this video, you're gonna learn how to insert and remove the NGT to our patient. So that's it. Thank you for watching.